Yeah, that's a very important question, and the role of surgery for gastric cancer has always been there, and it's going to stay. But the goal of surgery is, or how to improve surgery is, we want to make it more effective, so better oncological outcomes, but also enhance recovery of the patient, so decrease the morbidity and mortality associated with surgery. So in that regard, one of the things you mentioned, laparoscopic robotic or minimally invasive approaches, that's definitely on the rise. And there's more recent evidence showing that possibly a benefit in both the short term but also the long term of minimally invasive approaches, better resection status, more survival as well in certain cancers. So that's definitely a big area that continues to improve. The other ones are endoscopic management of gastric cancers, so taking out the tumor endoscopically rather than doing surgery. And there's criteria that we follow, but there's expanded criteria as well. So being able to offer the same limited approach to more patients without compromising the oncological status. So that's a big step forward. And then another one that is not vogue in Western countries but is under trial a lot in the Asian countries is something called sentinel node navigation surgery. So the reason we do gastrectomies or total gastrectomies, subtotal gastrectomies a lot of times, is to get all the lymph nodes around the stomach. But most patients, up to 70% patients, don't have lymph nodes positive, but we don't know who those patients are. So the sentinel node navigation surgery is kind of cutting edge, where we inject dyes and radiographic markers in patients near the tumor to find out which nodes they go to, select those nodes, and if those nodes are positive, then we can do the big surgery. Otherwise, we do the limited resection or function-preserving gastrectomy. So we don't do that in America now, but I think it's on the horizon. It's definitely been published in the literature, and it has good potential for early-stage gastric cancers for sure. Another thing we want to talk about in terms of advances, and we go back and forth in this, is the metastatic gastric cancer settings. So as surgery and surgical techniques and our whole, perioperative infrastructure improves, our surgeries have become safer, patients recover faster. So then now we consider doing surgery in more patients, for example, in patients with metastatic disease, who we previously may not have considered doing. So these are still under investigation and trial, but complete gastrectomy with cytoreduction, with or without HIPEC, are some emerging themes. And then surgery for oligometastatic disease, the only evidence we have is a previous trial, but there's new trials going on for these, and in the future it seems like we might be offering patients surgery even in the metastatic setting.